Hello everyone. My name is Carmen Liziswain from Switch On Health, and welcome to tonight's free webinar on Ross Walter's pathology analysis training. So if you are watching this live, please do stick around for the comments and the questions at the end. We're excited to announce that there will be a draw for a $50 credit from us here at Switch On Health for one lucky attendee to put towards your studies. So if you're watching this on YouTube, you're welcome to pop any questions you may have into the comments box below, and we promise that we will get back to you. Also, if you're watching on YouTube and you like what we do, please click on the subscribe button, because the more subscribers we have, the more we can offer, and we look forward to offering you more. So tonight, I'm very happy to be joined by Ross Walter. So Ross Walter is an award-winning experienced clinical nutritionist, naturopath, herbalist, and functional medicine practitioner who is passionate about helping people with their health through nutrition, lifestyle advice and changes, use of holistic modalities, and education. So Ross has developed a pathology analysis training course for health practitioners that covers the basics of which tests to get, what they mean, and what to look for to determine nutrient deficiencies and organ dysfunctions, why reference ranges are useless, and using optimal ranges that will help you to find the causes and factors of your client's symptoms and conditions. So tonight, Ross will give us an introduction of what he has to offer. So Ross, over to you. Thank you.
Thank you very much. Thank you, Carmen. Great to chat and see you again. Thanks to Switch On Health and everyone else here. Good evening, and welcome to this little bit of an introduction of pathology analysis. So I'll give you a little bit more than perhaps the introduction mentioned. So I'll give you some ideas and some clues and some benefits of being able to use pathology analysis in your clinical practice. So just a little bit of housekeeping, just to make sure you keep your microphone muted at the moment, just so we don't get interrupted. Please use the chat box to ask any questions. Just with how we're going, we'll probably answer the questions at the end rather than as we're going through the presentation. So take notes if you have any questions, or just put them in the chat box, and I'm sure Carmen will go through those and I'll answer them later. That's cool. So just a little bit of an introduction or an agenda about what I'm going to talk about. So just a bit of an introduction about me and who I am and how I work. Why we should actually use pathology analysis in our clinical practice. Some benefits of using the clinical analysis of pathology results. We'll look at quite a complex case study as an example of the types of things that we can find in the pathology results, and so you can see how that would work in practice. And then a little bit more information on the some of the training courses and things that we offer, and the questions and answers at the end as well. So just a little bit about me. So I am a clinical nutritionist, a naturopath and herbalist as well. I'm a mentor. I've been in practice for quite some time, so I do a lot of mentoring for students, for graduates, for practitioners as well, on typically difficult, chronic, complex types of cases, but obviously pathology results as well. I'm a bit of a major nerd for pathology, and so I'm based in Brisbane. I was working in IT in a past life, and I have a particular interest in a couple of main areas of root cause analysis. So that's an area that I don't think we get enough training on in our courses, but it's a belief that I've had for a long time before I even started practicing, that to turn symptoms and conditions around in our clients, I have to find all of the root causes of all of their symptoms and conditions. So not just perhaps the main issue that they think they're coming to see you for, but everything. Because I tend to find it's the same root causes that are causing all of their symptoms and conditions, so not just the main one. So that's my role as a practitioner, is to find those root causes, and then we can put some recommendations and a plan together to treat and fix those root causes. Because I believe that's the only way that we can turn symptoms and conditions around, and we can give people that long-term prevention and the long-term resolution of their health issues. Obviously, I've got a major interest in pathology, and particularly in the complex and chronic types of cases. So my unique, I have developed my own root cause analysis process, and that's the way that I've been working in my clinical practice for a long time. And so that root cause analysis process helps particularly well in the complex and chronic cases that I tend to see. But it does work with anything as well, even much simpler cases. So I do tend to see a lot of people with these chronic conditions and issues like autoimmune diseases, mental health, and even cancers. Okay, so the first section we're really going to get into is why should we actually use the blood test results, and why should we check them? There's a few reasons for this. Most patients do tend to come to see us after they've been to see their doctors, their GP, or even specialists, and they almost always have a bunch of blood test results that they have available, and they usually will bring them in to when they come to see you, even without necessarily you telling them to bring in the blood test results. So they sort of expect us to be able to go through the pathology with them and try and find some issues. But unfortunately, we don't tend to get a lot of training on pathology analysis in our courses before we graduate and before we start practicing. Pathology results can be a very, very useful source of valuable information on that you can help you find the root causes of some of their symptoms and conditions, but also organ dysfunctions that may be contributing to their symptoms and conditions, and nutrient deficiencies as well. But only when those pathology results are interpreted properly. And sadly, your GP and most doctors are not the experts in this. How did I get into pathology? As I said, I have always been a bit of a nerd for the very technical details, which is why I went into IT for a long time. And that actually was the result of wanting to work in the medical, scientific, the pathology area when I finished high school. So I had a great interest in a lot of the medical, investigative, detective sort of TV shows and series, and that got me interested in that. But when I went to the respective open days at the university for medical laboratory science, which I was interested in doing, and computer science, the talking to the students, the new graduates, and the scientists were saying that they didn't know about their careers. They didn't know if they were going to have a job or what type of jobs they were doing, etc. It was all very vague. And then I went to the computer science open day, and most of the graduates had at least, well, on average, 6 job offers already. And this was 3 or 4 months before the end of the year, before they'd actually finished. So they decided to go down the IT road instead of pathology. But it's interesting how the universe works to kick you in the direction perhaps that you perhaps should be working on. So it's quite ironic to sort of come full circle around. So as I said, patients normally come in with the pathology results, but usually and in 99% of cases, the GPs will usually say everything's normal. So the patient would go to see the GP, explain their symptoms and conditions. The GP will run a bunch of bloods, and you'd go back in the following week to get the results, and the GP would say everything's fine, everything's normal. This is not possible because people are not going to see the GP for a cup of tea and a chat. You're going because you're unwell and you want some help, and you want to turn your issues around. So if a GP says everything's normal, well, they've got nothing to go on to prescribe or recommend or treat you or to do anything. And many times my clients would say, but what about my symptoms? What about this? And the doctor's got nothing to go on. So a lot of the time they'll just say, I'll prescribe you an antidepressant to make you feel better. So this happens quite a lot. So this led me to, so when so many people were coming to see me after they've been to see their GP, in the beginning, they would say that their GP couldn't find anything, but they wanted help, obviously, with their symptoms and conditions. So I wanted to find out and learn more about pathology and how to analyze the results, but also really to try and find why doctors can't seem to find anything in the results. But that didn't take very long, and I'll explain fairly shortly why that is. And then after a number of years of experience and using pathology analysis from doing a lot of quite detailed and pretty expensive courses on pathology and their analysis, I realized there was an element of the analysis that was missing. So I combined my skills and my knowledge as a nutritionist into being able to find the hidden nutrient deficiencies that are not necessarily explicit in the pathology results. So nothing like obvious, like you're checking for your iron results or your vitamin D. So there are many ways that you can actually find numerous nutrient deficiencies that are hiding in some of the standard tests that you would get that are not specifically looking for that particular nutrient deficiency. So there's I've created this very, very unique method of pathology analysis that we'll go into a bit more. So this led me then to wanting to share this knowledge and information to many other practitioners and obviously students like you guys and your graduates as well. So I've created this new institution, this training institution for the Institute for Integrative and Functional Pathology, to train health practitioners like you in the skills and techniques of holistic pathology analysis. So this is really for nutritionists, naturopaths, herbal medicine practitioners and students, even allied health and other modalities where the practitioner may want to see or needs to see pathology results and wants to actually interpret them in a more holistic way. So the IIFP is really going to be, as it grows, the central point for clients to find IIFP practitioners, IIFP trained practitioners, to be able to get their pathology results analysed much more holistically in a much better way. So we offer several levels of training courses for practitioners. So we'll have a little bit more on this later, but level 1 is really just an introduction. This is approximately 5 hours of the basics, which tests to get, how to actually interpret the results in a better way, and a lot of case studies and examples. Level 2 is also available. So both of these levels are available now. They're self-paced. They're available as online recordings, and they're available now. Level 3, again, a lot more advanced techniques and more information to help you really master the art of The pathology analysis will be coming soon, possibly later this year, but more likely probably early 2024. We'll keep an eye out for that. And we'll also have a IIFP practitioner certification exam and qualification as well. So that'll be coming after the level 3. So a practitioner can do all 3 levels and pass an exam and show how good and competent they are in pathology analysis, and then they'll have a certification and qualification to go with that. So that's really cool. So the next section we'll look at what are the actual issues with lab testing, and maybe some of you might get my humor in the picture there. Let's move on. So there are a number of issues with pathology analysis in the medical world. So one of the main ones is that doctors are severely constrained by Medicare rules and guidelines as to what tests they are allowed to actually order or do for a patient. So because it is basically Medicare, which is effectively you as a taxpayer paying for someone else's blood test results. And so Medicare severely restricts the doctors as to what tests that they are allowed to do, and they need particular justification with diagnoses or symptoms or even family health history before they can actually order a particular test for you. So they can't order everything and hundreds or thousands of dollars worth of tests a couple of times a year. So they will often not do a lot of the tests that really need to be done, but that's because they get into huge trouble if they don't adhere to the rules. Doctors use pathology testing in a very different way to how I believe we should be, or how we use the pathology results. So they're using the pathology tests and results to diagnose a condition or a symptom in the person, because that's the medical model. They diagnose something and then treat or start a treatment plan or recommendation to treat that diagnosis. They're not treating the individual. They're not treating the root causes of their problem. They're treating the condition or the diagnosis, which is a little bit backwards in my opinion. Whereas we are really more about using the pathology to find the root causes of their symptoms and conditions, and all other factors like organ dysfunctions as well that are contributing to their symptoms and conditions. Doctors actually don't like naturopaths and nutritionists, etc., referring clients to them, as in like a GP, just to get blood tests done and rebated through Medicare for nothing. Because a number of years ago, probably 3 to 4 years ago, the Professional Association of General Practitioners in Australia, so it's the Royal Australasian College of General Practitioners, sent an email to all GPs in Australia to say, if you get an email or a letter or a referral of a patient from a nutritionist or naturopath to get blood tests done, you are to ignore that request. So it's just ridiculous, really. Luckily, perhaps many GPs don't entirely adhere to that, but they still are very restrictive of the types of tests and the number of tests that they will actually do for someone. There's ways around this. There's better ways, and as a practitioner, you can open accounts with the pathology labs, and you can give patients a pathology request form, and they can get the tests done through you. But because you're not a doctor, you can't bulk bill or rebate the cost of those tests to Medicare, so they do need to be paid for. But to be honest, most people will rather pay for the tests than having the hassle of going in to see the GP, waiting for God knows how long in their infested waiting rooms, and then having to go back the following week to get the results, only basically to be told that everything's fine and everything's normal. Probably the biggest issue with pathology analysis in the medical area is that doctors don't understand what we call the reference range, which I'll talk about in a little bit more in another couple of slides. So yeah, we'll move on to that shortly. Doctors often ignore abnormal results, so results that don't necessarily fall into the reference range. They sometimes miss, they sometimes ignore, and even in many cases, in my experience, even extreme results, they don't really understand what it means, so they don't do anything. So it might appear that they're ignoring those results, and maybe they are, but they just don't know what it means or what to do. This is less of an issue. Occasionally, probably about 1% or so of the time, as a practitioner, I want to see someone's past or recent blood test results, because quite often the doctors don't automatically give the patient their test results. So when we're trying to get a copy of them from the patient, and the patient's trying to get them from their doctor or their GP clinic, occasionally they refuse, and they'll claim that those tests and those results are our information. Well, no, they're not. They're the client's or the patient's information. But don't worry about that. There's ways of getting around that. So mainly as a practitioner, I have accounts with all the labs, and I can usually prove that I'm the practitioner of that client or that patient with their date of birth and or their Medicare number, and I can usually get the results directly from the lab if that's needed. So it's much less of a problem, but it's a bit of a hassle. There's also different units of measurement for some of the tests. This is, again, less of an issue in Australia, but occasionally you do get different labs in Australia that use a different unit of measurement for the same test. So it can be a little bit frustrating when you think you're analysing a result and you think it's really, really high or really, really low. It's just they're using the wrong unit of measurement. But this is a much, much bigger problem if you happen to be analysing bloods from another country like the UK or in Europe or the US. And as we know, the US has got to be the worst here because they like to have a different unit of measurement to the rest of the world. So it's really frustrating trying to analyse results from there. But there's ways around that, and you can convert to the more usable units of measurement that we use here. Mistakes and errors do occur in the lab sometimes. I've already mentioned the reference range versus the optimal range. We'll talk about that again in a moment. Different labs use different equipment for testing. So sometimes you can test the same test at two different companies and you get very, very different results. So it is sometimes better to use the same lab each time, so you're getting consistent results on the same equipment. And if you're familiar with statistics, you probably understand the concept of the bell curve, where average results across a broad spectrum of people will fall into like a bell shape. And the majority of people will fall into the middle of that bell shape, and only a small percentage of people will fit into the results of the average on the extreme ends of that. But not all tests sort of fit that model, and we talk about that a little bit more in the level 1 training. Doctors generally and most practitioners generally analyze bloods by comparing your result to the reference range in isolation or independent to any other result. So is your result in the reference range? Well, if it is, you give it a mental tick and you move on to the next one, but not looking for confirmations of that result with other related tests, not looking for combinations of results that can really point you in the right direction as to what might be some root causes of the abnormal results. So it's important more important really to look at the results as a whole rather than just individually or result by result or line by line. Results can be different for different people as well. We all have different genetics, especially across different ethnic backgrounds. So what type of result that's normal for one person isn't going to be normal necessarily for someone else. And general practitioners really don't know how to analyze blood tests properly, and you'll see in a moment why that might be. So pathology analysis really is an art and a science. So there's a lot of science behind pathology testing, but it's a real art in being able to analyze the results in a holistic way and a meaningful way to get the best information out of it for your patients. So the biggest issue with pathology analysis is this concept of the reference range and the optimal range. So if you've ever seen some pathology results, either yourself or someone else, a result, a particular test will have anything from 1 to 20 different markers on it, depending on what the test is or what it's looking at. There'll be a number of columns in the middle of the report where you've had the test done, but at different times, different dates, for example. So it's really useful to, in analysing the results, looking at how those results are changing over time. Are they getting better? Are they staying the same? Or are they getting worse? And typically on the far right-hand side of the pathology results, we get what we call the reference range, and I'll have an example shortly. So the reference range is sometimes referred by some people as the normal range. Sometimes it's referred as the standard range, when it really isn't either of those. The reference range is simply a statistical average. It's not a target or a goal range to actually get to or achieve. It's just a statistical average. And we at the IIFP recommend that you completely ignore the reference range. And that might sound like a bit of a shock to people. It might sound a bit controversial, but I will give you the answers as to why. But in order to do that, I want to ask you a question. And if you can answer the question in the chat box, because I really want to see what your responses are to this. So if you can answer this question, what do healthy people get blood tests? I'm just watching the comments. So I think the most people have said yes, healthy people get blood tests, and a couple of people said not usually. So let's have a look. So the answer really to that question is no, they don't. For a couple of reasons. As I said before, healthy people don't go and see a GP for a cup of tea and a chat. And even if you did, and so you went to see the GP and the GP said, how are you feeling today? And you said, I'm feeling wonderful. Can you run all those tests for me again? And they'll tell you to get out, because they're not allowed to order the tests according to Medicare rules unless there's some medical justification for basically the taxpayer paying for those tests for you. So you have to have some symptoms and issues. You have to have family history of a particular condition, and only perhaps in the extreme cases would someone is going to a GP for like a medical checkup, and then that's usually charged appropriately. So no, healthy people don't get blood tests generally. So therefore, the reference range. So you can add your comments in the chat box when this clicks with you. The reference range is basically just a statistical average of unhealthy people who get blood tests at approximately 95% range of those unhealthy results is what the reference range is. And it's typically the results at that particular laboratory. The different laboratories have their own data, their own statistics, and therefore they have their own reference range. But then a GP is trying to understand what's wrong with your blood test results and comparing your somewhat unhealthy result with everyone else that's unhealthy, 95% population, and then not finding any difference. And then telling you that everything is normal. Get it? Let's have a look at some of the comments. Yeah, there's a few people quite shocked by that. Yeah, but isn't that insane? It is absolutely insane, but this is exactly what goes on when people get blood tests done through their GP and through the laboratories. So clearly that's not the way we want to work. That's not going to give you any help. It's not going to get you feeling better. So here we're having a look at a sample, an actual blood test result. So this is the thyroid panel, a bit more of an extensive thyroid panel test for a particular client. So this particular test has got 5 markers. We can see that with the 5 rows through the middle of the report. There's also 5 columns and dates where that test has been repeated, different months, different years, across about 3.5 years worth of results. And we can see the different results there. In two of those years, or 2 of those columns, the GP only tested the TSH test. So this is the thyroid stimulating hormone. And whereas the other tests, when they were done, the GP did some more extensive testing there as well. Sometimes a lab will use the reference range to highlight particular results that fall outside of the reference range. So in this particular case, this lab colored the results in red. And so you can easily see which ones have fallen out of the reference range. The reference range is on the far right-hand side and circled there. So a range in between 2 numbers, sometimes greater than some number, sometimes less than some number, but that's the reference range. Sometimes the labs will put a header or above that column saying reference or reference range, but many times like this one, they don't, but that's what the reference range is. And here's an example of a completely different test. This is the iron studies test. This was done through the same, from the same client, admittedly at different times and using 2 different labs. So these are 2 of the labs that are accessible in Queensland, where I am. So QML is the top one, and then Sullivan-Nicolaides is the bottom set of results. So we're really looking at the differences in the reference range, but the Sullivan-Nicolaides test actually did 5 markers for the iron studies test. The QML only did 4. But you have a look at the underlined reference range for those same 4 tests that are in common there. Every single one of them is different. So as I said, the labs have their own reference range because it's their own data, it's their own statistics. It's not a standard, and it's certainly not the healthy range that you really expect that those reference ranges should be. So I'm sure that's quite eye-opening for most of you. So we really need to, as I said before, ignore the reference range. You have to ignore it. It's useless. We need to use what we call the optimal ranges instead. So these are based on many of the training courses that I've done, many textbooks on pathology analysis that I've got. And these are based on studies that are done on healthy populations. So, and for many tests, many of the reference ranges are different whether for men, for women, for children, for elderly people, for pregnant women, because all of their results are going to be very different. So you need to understand those the different ranges for different situations as well. So the optimal ranges, unlike the reference ranges, are the target range that you want to achieve. They're the ranges that you want to get the patient's client, the patient or their client's results to. So it's a much better way of analyzing the results. And any of the results that are outside the optimal range are easy to find. They're usually colored differently or bolded or highlighted. So, and when you're using the optimal ranges and the values are outside of the optimal ranges, that there's a big problem there. Optimal ranges, when you're using those for pathology analysis, will give you a massive advantage over your colleagues, other practitioners, and even the GPs and specialists in analysing a patient's blood pathology results, because you'll be able to find the root causes to their symptoms and conditions and other factors that are causing their issues well before they become a major problem, and before those doctors and specialists will ever find those as being a problem. So some benefits of actually using these techniques for holistic and nutritional pathology analysis is that they can be used as one piece of the puzzle in the overall analysis and investigation of a client case, so that they can be used to confirm signs and symptoms that you might suspect. You might be able to use the pathology results to find causes of those symptoms that you might not suspect. You might come up with some actual surprises in the results, but that's good because you can then start to do something about it. So you can find organ dysfunctions, nutrient deficiencies. You can use the pathology results as a baseline. These are the results before you start treatment, and then after you start the treatment plan and recommendations, maybe 3 or 6 months later, you can potentially retest, redo those tests. Bless you. Can you please just check your microphone and mute your microphone, please, everyone? Just check that. So you can use the pathology results as a baseline, and then recheck with subsequent testing, and make sure that the client's still heading towards the target, which is the optimal range. And you can certainly use that as a goal line, like where you get to that goal. Well, you probably don't need to keep taking those supplements or keep doing that treatment. You can probably stop at that point. So you can also use the techniques that we help you with and train you with to offer pathology analysis services to your clients. And there's a number of ways you can do that. And so you can use that in your marketing, in your social media marketing. Say I've done the IIFP pathology analysis training. You've had a bit of experience with using the techniques and being able to find the root causes and the deficiencies and dysfunctions, etc., in the results, and you can use that in your marketing to try and get more clients to come and see you, or offer that as an additional service to your existing clients. And because you can use these techniques and you can find symptoms and conditions, dysfunctions, etc., in their results when the GP hasn't been able to, you will get a massive amount of credibility and trust with your clients, and they will keep coming back to you. So even sometimes some clients are on a 3-monthly or 6-monthly checkup for their particular chronic health condition, where they automatically get their results redone every 3 or 6 months. Those clients will take advantage of that with their GP. They'll get copies of their results, and then they'll come back to you to get those results analyzed. So it's a really good way of having that, those clients coming back to you, obviously regular income for you, and you being able to help them further as well. So the pathology really is just one tool that you should or can be using in your clinical practice. So you still need really good detailed questioning, note taking in your initial and subsequent consultations. So going through their main issues of concern in a lot of detail, but also questions on their diet, their stress levels, energy levels, bowels and bowel motions, sleep questions, hormone related questions if they're female, their health history, their medical history, their family history, and the supplements that may be taking, any medications that they may be taking, any side effects or issues with them taking those. Physical examinations when you're in clinical practice as well, so perhaps blood sugar, blood pressure, using a pulse oximeter, looking for pulse rate, oxygen saturation issues, which I highly recommend you do, because you find a lot of issues with using that in a lot of people. And then obviously there's signs and symptoms and presentation as well. So you need to do all of these basic things, but analyzing the blood pathology is another tool that works together with all of those. So maybe to summarize this section, if the GP can't find any issues in your pathology results or your patients or your clients' pathology results, it's going to be up to you. You have to be able to analyze those bloods and find what's going wrong with them. And you can absolutely do that. That's the training that we give you to be able to do that. Your clients and even the general public need you, because they don't realize what I said before. They don't know and understand that the reference range is not a normal range. It's not the standard range. It's just useless. And you have to use the optimal ranges for those tests and other techniques to really find what's going on with someone in their results. So knowing this training and this information and these techniques, you will have an absolutely massive advantage over your colleagues or over other practitioners, and even over the GP, even over the specialists that get paid an absolute ton of money. You have a huge advantage over them in being able to find issues in the results for your clients, and be able to help so many more people get their health back. So I want to go through and give a bit of an example of the types of information that you can find in a pathology case. So we haven't got a huge amount of time in this session to go through this. So the initial level 1 training is 5 hours, for example. But I'm going to go through quite a complex case with a lot of symptoms, a lot of conditions going on. It's probably one of those conditions, one of those cases that you'll almost certainly see in your clinical practice. But if you were to sort of come straight out of college and start seeing someone like this, you'll probably go, oh my God, where do I start? What do I do? So as long as you have a process around your consultation structure, and there's no reason why you can't take on someone like this. But understanding their pathology results is really, really going to be helpful in pulling apart their case and working out what's actually causing their symptoms and conditions. So we'll have a look at this quite a complex case. So this is a 40-year-old female with severe fatigue that I saw a couple of years ago. The main issue of concern was around the severe fatigue. She's a mother of 3 or 4 children. She can't work. She just has not got any energy beyond mid-morning to be able to do anything. Very, very low immune system function, with an infection seemingly every couple of weeks. Some additional symptoms that she was experiencing, including sleep issues, headaches, anxiety, hormone imbalance with her cycle, lots of cycle issues, very heavy periods, lots of pain, very irregular, PCOS, hirsutism, which is increased body hair in places where a female normally wouldn't get them. That is actually related to PCOS, endometriosis as well. Lots and lots of stress, but that's mainly due to her health issues. She's stressing out about that. Allergies, food intolerances, atopy type conditions, sinus and congestion and sinusitis that's related to allergies as well. Lots of skin issues, eczema, poor nails, hair loss, and quite thinning hair. Lots of digestive issues, the stomach issues with reflux, but then further down, digestive issues with constipation, gas, bloating as well. Osteopenia, so that's like the first sort of stage or first level of weakened bones or reduced bone density, which really shouldn't be happening at her age. I mean, 40, usually tend to see this more in menopausal women, probably 10 years older than this, but she really shouldn't be seeing this yet. There was some evidence of heavy metals, root canals, some Epstein-Barr virus, cytomegalovirus infections, and even more. This lady came into me with 4 folders of an inch and a half high folders of pathology tests that she'd received from numerous practitioners, and none of them were really able to interpret those results and find what was wrong with her. A little bit more background. Her husband is a doctor. He couldn't figure out what was wrong with her. She'd seen a lot of GPs. She'd mentioned at least a dozen GPs. They couldn't figure out what was wrong with her despite all the tests that were done. She'd seen 4 specialists that the GPs had referred her to, an endocrinologist, gastro, neurologist, and an immunologist as well. None of them could find what her problems were, all the causes of her issues. Then she started seeing integrative doctors. So they're a little bit more aligned with what we do. They receive training on nutritional medicine, environmental medicine, and a little bit more holistic than your average GP. But they typically are very expensive. So 2 of those, and they again could not find what her symptoms and conditions are, or the causes were, and just still had no clue as to, or answers to, what her issues were. And so this was the first time that she'd gone out of the medical realm. And she came to see me, so no pressure, hey. So we're going to have a look at some blood tests, and I'll give you my thoughts, my findings on the results, what those results may mean or what they may be causing in someone, and what's actually going on with her. So this is the hematology test, or often called a full blood count or complete blood count. So the first 4 lines are related to the red blood cells, the count and quality of the red blood cells. The following 6 lines are related to the white blood cells, so that's your immune system, infection fighting cells, and then the platelets at the end. So we've got I've got the column of the optimal ranges there. We do have the reference ranges on the right hand side, really just for a laugh. I mean, did I say that out loud? An interesting comparison to the optimal ranges, perhaps I should say. And like some of the labs where a result is outside of the optimal range, I've highlighted it in red, so we can clearly see the ones that are not normal. So the first one there is the hemoglobin. So hemoglobin is a bit low. So hemoglobin is the oxygen carrying protein in the red blood cells. So its purpose, and really the purpose of the red blood cells, is to carry oxygen around the body to all the cells and tissues so they can use it for energy and function. So if there's low hemoglobin, then there's going to be less oxygen supplied to the tissues. And one of the biggest tissues that really needs the most oxygen is the brain. So that's going to cause a lot of mental fatigue, poor memory, brain fog, poor cognition, but also that the lack of oxygen around the rest of the body is going to cause fatigue, muscle aches and pains, headaches, even migraines in some people if it's perhaps low enough. So you can see how the low hemoglobin is going to cause a lot of, or potentially cause a lot of symptoms and conditions, and many of those that I've mentioned are already what she's been experiencing. So the headaches, the low energy and fatigue, and probably more. So that low hemoglobin immediately tells me that's anemia. So that's what anemia is. There's 20 different types of anemia. It's not all about iron. So there's a B12 deficiency anemia, there's a folate deficiency anemia, there's a whole bunch of others. So there's anemia there, and then I need to try and figure out what type of anemia she has and why. That's my goal. The next red result we've got is the red blood cell count. So that's just a little bit high. That just simply means that they're likely dehydrated. So it's a good easy one to fix. So if you're dehydrated, then your blood will also be dehydrated, meaning it's going to be more dense, thicker with the red blood cells, and it's going to be more difficult for the heart to pump that more dense, thicker blood around, which is going to raise your blood pressure as well. So have another drink. MCV stands for mean corpuscular volume, or basically the average volume of the red blood cells. It's one of my favorite markers to check and test for and look at, because that single test and its result can indicate potentially 5 different things, of which 4 of them are nutrient deficiencies. So one of the issues with the MCV is, or the reasons why that might be high, is because the person may be suffering from blood loss, and that can be a female, perhaps with very, very heavy bleeding and periods. It can be someone with internal bleeding in the digestive system, or after an injury or a wound or something like that. So the body's then trying to make more and more and more red blood cells to counter what's being lost. And in that rush to make more blood cells, the body can run out of nutrients that are needed to make and fully mature the red blood cells. So what's happening here is that the immature red blood cells are actually larger than the normal red blood cells. So the high MCV indicates either blood loss, increased production of the immature red blood cells because of a greater need for having more red blood cells, and or nutrient deficiencies of vitamin B12 and folate if the MCV is higher than usual. If, on the other hand, the MCV is on the lower side, then it's actually indicating a deficiency of vitamin B6 and or iron. So we can get a lot of information just from that one test, even though those nutrient deficiencies are not explicit. They're not explicitly testing for those particular deficiencies. So you can get some really good clues out of some of these results. And then what you want to do then is to potentially look at checking some of the other tests and test results, like the iron studies test, the B12 and folate results, and actually confirming or maybe ruling out whether someone actually has those deficiencies. Because if you rule some of them out, then it can give you clues as to where what other deficiencies are actually causing that abnormal MCV result. let's move on. The white cell count is just in the optimal range, but only just. So it does suggest there's the tendency of having a low immune system function there, and possibly related to chronic infection. The 5 lines underneath the white cell count are 5 different types of white blood cells, and they typically respond to different types of infections. So usually neutrophils are responding to bacterial infections, lymphocytes are responding to viral, monocytes can really respond to anything, including fungal. Eosinophils are a special type of white cell that responds to allergies and or intestinal parasites, wormies. So she's got a little bit of an imbalance there with the neutrophils, possibly suggesting an active or current or a chronic bacterial infection, and the high eosinophils even may suggest in her case allergies, which she does have some allergies, but it may also be she may have some intestinal parasites or worms there as well. So there's a lot of additional information that we can get from the results that are not necessarily obvious, and we've got some details down on the bottom to explain that. So in the same person, these are their they just so happen to have the vitamin B12 and folate results. So there are 2 vitamin B12 results here. Let's have a look at the second one. The active vitamin B12 is the actual B12 level, and it is only just in the optimal range. The other B12, so the total B12 result, is looking at it in a different way. This indicates the body's need for more B12. And when, as we can see there, the total B12 is only about half of where it should be as a minimum. That's indicating a much greater need for B12. And the active B12 is a little bit borderline for the actual level. So it definitely would be recommending some more B12 for this person. Serum folate is so folate is a B vitamin that typically only comes from plant-based foods. So the word foliage, meaning plants, even though folate is found in all plant foods, not just in the green leafies, but and as opposed to B12, that's typically only found in animal products. But the high folate level there, or slightly high folate, can be indicating a couple of different things. Their diet is high in wheat products that are fortified with folic acid, which is the completely synthetic form of folate, and it's not metabolized and used by the body in the same pathways. It's a much slower, longer process for the body to use folate or folic acid. And this can lead to, or the folic acid can also be in a lot of cheap supermarket or pharmacy B vitamins, for example, that use folic acid because it's cheap. It's also very nasty, but it's cheap. But it doesn't work in the same way as natural folate. So what can happen is that the folic acid can be blocking the folate receptors on the cells, and it is known to then block the cell's use of the natural folate from foods. And this can be pushing up the levels of folate up and up and up and up to high levels like this, which can actually, in some people, indicate a toxicity, but it can also indicate that the body is not able to use the folate. And so the levels are going up and up and up at the same time as creating a functional deficiency of folate, and therefore the folate deficiency symptoms. It's also interesting when we look at the B12 and the folate together. So if you understand the methylation pathways, or if you have a look at the methylation pathways, you'll see that vitamin B12 and folate are highly dependent on each other. So you need to have good levels of both. Otherwise, if one of the two are low, the body can't use the other one, and vice versa. So with the B12 being really low, it's possible that the low B12 is preventing the body being able to use folate, and that's allowing the folate level to get higher and higher, but then basically creating a functional deficiency of both of them, which is really not beneficial at all. Okay, let's get on to the iron results. We don't just look at the red results, the ones that fall outside the optimal range. We need to look at really all of them. So one thing that stands out a little bit is the TIBC in the iron results there. It's borderline high, so it's only a couple of points off the maximum, which can indicate an iron deficiency or a tendency for that. The saturation is sometimes called the transferrin saturation. That's just a little bit low. If I look at that on its own, that would also suggest an iron deficiency. But the way to analyze and interpret the iron results, that you have to look at the saturation result together with ferritin. So the transferrin saturation is a level of the transport protein for iron, which is called transferrin, and ferritin is your body's storage form of iron, typically in the liver. So this is a really fascinating situation, and how our bodies work. So in times of infections in the body, typically bacterial, but it can be others as well. In times of infections, our body seems to understand that the pathogen, such as bacteria, needs iron to replicate and spread in the body to get more of the infection occurring in the body. So our body seems to understand this. So when we have an infection which causes inflammation, the body will sequester the iron that's being transported around the body, bound to the transport protein, which is transferrin, and moves the iron and binds it to ferritin instead. So changes the iron from the transport form to the storage form and takes it out of the blood. So this then drops the saturation level, but then raises the ferritin a little. And this actually is a defense mechanism against infections to stop the infection from using the iron to replicate and spread. So it's a really, really cool mechanism of the body. So that's what we're looking at here. And we saw before with the imbalances in the white blood cells and the slightly borderline low white blood cell count, that there's a strong immune system response occurring there. So this does tally up with these findings in the iron results. So the body's got an infection. The body's moved the iron out of the blood into the liver to be stored to try and defend itself and stop the infection and slow it down. Very, very cool. Okay, the thyroid results here. So we'll start with the first one, the TSH. TSH is the thyroid stimulating hormone. It's actually not a thyroid hormone. It's a pituitary hormone, but it's produced in the pituitary to stimulate the thyroid into action to make its thyroid hormones, which are called T4 and T3. So we've got a slightly high TSH result, which is sort of reverse logic. So the higher the TSH is, the lower functioning the thyroid is. The reason is because the pituitary is constantly measuring the levels of T4 and T3 in the blood. And if the pituitary gland doesn't think that the thyroid is doing its job properly and producing these hormones, it will make more and more and more and more TSH to stimulate the thyroid. It's like, come on, mate, get a move on, make some more thyroid hormones. And the thyroid's just going, oh, well, I've only got so much nutrients and zinc and vitamin D to do that. I'm doing what I can. So when you see the TSH going higher, then the thyroid is lower functioning. And we've got a confirmation of that with the T4. The T4 level is just slightly low. So that does confirm the low functioning thyroid there. So further investigations in the consultation and questioning will be looking at why. What's actually causing the thyroid to be low functioning? And there's a lot of factors that affect thyroid function, and we cover that a lot more in the level 1 training. We've also got in these results here, actually, before we get into that, so low thyroid function is going to present itself as a low metabolic rate and low metabolic function in the body, because every single organ and tissue and cell in the body responds to thyroid hormones to control its metabolic rate and function. So if the thyroid is low functioning, everything in the body will be low functioning. So that's really not what we want. So you're going to see that as low energy, fatigue, brain fog, poor memory, cognition, poor neurotransmitter production for poor mental health. So the brain is just not getting the function and the metabolic functions that it needs. Poor hormone production, like in male and female hormones, poor digestion and absorption of nutrients, poor tissue repair. Basically, all other sort of low and slow states in the body are going to be affected by the thyroid function. We've also got in those results, the last 2 lines there, we've got the thyroid antibodies. So these are markers of autoimmune issues going on with the thyroid. So autoimmune means your immune system is attacking yourself. And in this particular case, the immune system is attacking the thyroid. And that will be reducing the thyroid function. And that really needs to be addressed, because that's just going to get worse and worse and worse over time. Autoimmune conditions almost always usually suggest a leaky gut. So leaky gut causes immune system dysfunction, which then causes autoimmune activity against different tissues and different parts of the body. So where there's autoimmune issues, or where there's antibodies like that, is suggesting that this person has leaky gut as well. And it's interesting from all of the other results that we've already seen. So it's good to remember the abnormal results that we've already seen. The low B12, low folate, low iron at the moment are all going to contribute to the low thyroid function. And we haven't even gone through all the results yet. You can see, hopefully you can see how everything is related when you analyze the results this way. So other pathology results that we found in the same client. So she had a very low ALP. So this is one of the liver markers. This is an indirect marker of low B12, low folate, low zinc, and low thyroid. So we've already got 3 out of those 4 confirmed. So that's how we use confirmations and combinations of results. She had slightly higher cholesterol. Not that I was really worried about it, but the doctors were. High triglycerides. So these indicate some level of stress in her life, which is obviously was having, and a diet too high in carbohydrates, which causes the high cholesterol and triglycerides. She had very, very low cortisol, sorry. So low cortisol suggests a chronic, very chronic stress picture that's basically worn out the adrenals and fatigued the adrenals. So we often call this as adrenal fatigue. The medical system tends to dismiss that as not a real thing, or if they do, then they call it adrenal insufficiency instead. So the adrenal glands are supposed to produce our stress hormones, cortisol, adrenaline, and other hormones as well for whole body function. But when the adrenals are producing so little of it, then there's a lot of nutrient deficiencies and or chronic stress that's behind that. And that can lead to a lot of chronic fatigue symptoms as well. We also found low vitamin D. So vitamin D is a huge immune system booster. It's absolutely needed for optimal thyroid function. And vitamin D in the body acts as an anti-inflammatory hormone to reduce inflammation. So therefore, if vitamin D is low, inflammation does tend to be increased. So we've got another couple of reasons for the low thyroid function there. Low potassium, that can affect heart and muscle function. Low phosphate. So if you've done your early anatomy physiology subjects, you'll know that our energy is measured in, our energy currency is ATP, as adenosine triphosphate. Well, the phosphate part is where you're getting your phosphate from. So if there's low levels of phosphate in the results, then you're going to have low energy production. There was also borderline low protein and albumin. So albumin's just another transport protein in the body. So these results can indicate low protein intake in the diet. So you need to check that. Are they eating enough protein in each meal? Or is it actually poor stomach function? Are they eating enough protein, but their stomach isn't digesting and metabolizing protein, breaking them down into the smaller amino acids that you need to be able to absorb and build those proteins? So this is suggesting a poor stomach function and low acid and enzyme production in the stomach. So we need to again find out why that is and then fix those issues. And when there's low stomach function, you'll almost certainly have other nutrient deficiencies as well, not least of which some we've already seen: low zinc, low B12, low folate, low iron, and as well as the low protein levels here as well. They're all highly dependent on having good stomach function. You're getting a lot of clues out of this. So you have positive IgG antibodies, so long-term antibodies to CMV, or the cytomegalovirus, and the Epstein-Barr virus as well. So just taking a step back and looking at all of the results that we've seen in this client. So the main issue of chronic fatigue is being caused by nutrient deficiencies of iron, protein, B12, folate, and phosphate that we've found indirectly in the results, directly or indirectly. Also, the fatigue's been caused by anemia, which causes poor oxygen supply, but also a low water intake from dehydration. We need water in the energy production processes, so dehydration leads to poor energy. Also, low thyroid function contributing to the low energy, the adrenal fatigue as a result of the low cortisol, and likely a recurrent Epstein-Barr virus infection, which is causing that recurrent infection. And we do know that that causes chronic fatigue as well. Other main issues around the low immune system is being caused by nutrient deficiencies of protein, B12, folate, and possibly zinc, but we haven't got that one, or we didn't have that one tested at that stage. We did test later, and that was very low. Low water intake again, low thyroid function, stress, and likely recurrent EBV infections. You can see the same things are coming up all the time and causing all of the main issues. The low thyroid function has been caused by similar nutrient deficiencies again: iron, protein, B12, folate, and vitamin D, being affected by the anemia. So thyroid's just not getting its oxygen supply that it needs. Thyroid is greatly affected by stress, heavy metals, and obviously the leaky gut that's causing the autoimmune activity and leading to thyroid damage, which is reducing its function. The recurrent Epstein-Barr virus is known to cause damage to the thyroid, autoimmune thyroid conditions, and we're seeing that in her results. Some other additional findings or diagnoses that came out of the pathology results, even not looking at the questioning from the consultations, etc. So just from the pathology results, the autoimmune thyroid condition is Hashimoto's disease. The low functioning thyroid with autoimmune activity is Hashimoto's. Chronic recurrent Epstein-Barr virus, adrenal fatigue from the low cortisol and the stress. We did actually test, I suspected this in this condition in her. We're not going to go through this because it's a whole other topic to talk about. Pyrrole disorder was suspected, and we did test, and that was confirmed with her as well. So that actually causes the chronic fatigue, low immune system function, the low thyroid function, leaky gut, many of her other symptoms and conditions, the headaches, the hormone issues, cycle-related issues, and a lot of other things. So it's a genetically inherited mental health condition with really whole body effects. That was confirmed with her as well. And hopefully, as you can see, everything is connected. Everything is related to the same or similar things. So the same root causes are really causing all of her health issues. So I hope that that helps you sort of see a little bit more about what I do and how I use the pathology results with everything else on top of the questioning in my overall analysis. Okay. A little bit more information, how to find some more information in training. So as I said, the IIFP provides some training courses on pathology analysis, and this was just one example of how to use that and how to get that information and use that in your analysis, but also your treatment recommendations. So we start with the level one. So the level one is looking at the basics of pathology analysis. Some of these things I touched on a little bit briefly earlier on. Why doctors don't find anything, using the optimal ranges, what tests to actually get or do for clients, which are the best ones to look for, how to find organ dysfunctions and nutrient deficiency. So we didn't look at liver dysfunctional, kidney, or other things, but that's all in this training in a bit more detail. How to use confirmations and combinations of results. We saw a little bit of that earlier. And how to use our IIFP software, pathology analysis software, for your clients to generate reports, to go through the findings of the results with them in your consultations, and using that the software to actually build your clinic. So marketing services, marketing your pathology analysis services to your clients or to the general public to get them to come and see you, and so that you can find issues where their GP hasn't been able to. It's a brilliant way of being able to use these skills and techniques to build your clinic. Training goes into a lot of different case studies on some quite common symptoms and conditions, but some unusual ones and unusual results as well. And there's about 5 hours of training in the level one. So have a look at the website and the link there for more information and the training courses there. So the level two is a little bit more detailed. We go into more detail on some of the same tests, but a lot of other additional tests as well. We look at the pathology results, looking at it in a different way, looking at the pathology results for some common conditions and diagnoses, but also some uncommon ones, or ones that you probably should see, but you probably don't realize that what you're looking at. It goes into a little bit more on the pathways and some biochemistry, not too detailed or technical, but you should be able to understand that, especially around methylation, because it's really, really important to understand that. Digestive system function and how a different way of looking at digestive system function and conditions and symptoms and what they can tell you about the digestive tract and digestive conditions. More case studies, and there's approximately 6.5 hours of training in the level two. Again, more information on the website. The level three training is being developed. It's not available yet, but when it is out, that will be really going to help you become 100% confident in being able to analyze the blood tests similar to what I do. Like, for example, many times people will send me, like the public or even someone I don't know, will send me their blood test results. I quite often tell them, don't tell me what your problem is. I'm just going to read the results in a holistic way, like I did earlier with this case study, without knowing any of the symptoms and conditions that they have. I love that, because I'm really, really confident in what I do. I understand the bloods and the relationships between them, and I guarantee that I'll find symptoms and conditions or issues in their blood pathology and being able to relate them to the symptoms and conditions that they're having. And even though I don't haven't been told what those issues are, so they're usually blown away that I'm being able to find confirmations of issues and maybe even things that they didn't know that they had. Then we'll look into more of the causes of abnormal results and why. More case studies. There's probably going to be more than 6 hours of training on the level 3, and we'll introduce the IIFP certified practitioner qualification as well in the end of that training. So it's probably late this year, 2023 or early 24 perhaps. We'll see how we go. Again, see the website for more information. I did mention earlier the IIFP software. So this is a tool that I've developed to help practitioners analyze blood test results, but then using that a lot more for a number of benefits here. So to try and improve the efficiency of analyzing the blood test results, all of the optimal ranges and results are there. So you don't have to remember what the optimal ranges are, or what an abnormal high or low result might actually mean. That's all in the software. And if you want to be able to offer new services for clients, to help your clients better, get more repeat clients coming back to you, and even make more money by offering these additional pathology services, you can do that with the software. So it's for recording results, automatically showing abnormally high or low results based on optimal ranges. And it's a learning tool as well, so you don't have to keep going back to the training when you are not sure about what a particular test is or what an abnormal high or low result might mean. And then you've got the pointers and clues in the software, and you can generate reports, a couple of summary reports, but a very detailed report as well, which can be used for you as the practitioner, or you can go through the once you've analysed the results, go through within a consultation or a chat with the client, either go through the summary report or the fully detailed report, which can take a bit longer. And then you give them that generated report for their records as well. So it helps to explain to a client why they are having the symptoms and conditions that they have, or the diagnoses that they have, but also what you're going to do to turn that around and help them. And you can use the results obviously to prove that your treatments are actually working when you're seeing improvements, and being able to find issues when other practitioners can't. And when you find issues, then you can treat and fix them, and you can get your clients a lot better. So the software is useful for finding deficiencies, dysfunctions, excesses of nutrients as well, confirmations of symptoms and conditions, helping to understand the cause of the root causes, checking on your progress of the clients, and obviously showing the clients that you really know what you're doing with your pathology analysis, and teaching them more about pathology as well. So other services that we in the IIFP can provide, so we do provide analysis of pathology results. If someone wants to tell us what their issues are, that's fine, but as I said, we're happy to do it blind as well and without knowing. We do offer mentoring for practitioners, even students, on pathology analysis, and case analysis for chronic and complex cases, similar to one that we went through earlier. Other informal, more casual training for practitioners as well, maybe on different symptoms and conditions, etc., without going into a lot of stuff. We want to have a central directory for the IIFP trained practitioners, but that won't be until the certification level and the level 3 training is done. And we want to try and raise awareness of more holistic analysis of pathology results, trying to get more people to understand why the way that doctors and other health practitioners are not really analysing bloods properly. And perhaps in future, we want to be able to provide training on non-blood pathology tests like hair tests or whatever else it might be, microbiome tests, and make them a little bit more usable as well. So because we like you guys, we like Switch on Health, we support what you guys are doing for you, the students, but also the industry. We do want to, and obviously for this opportunity to be able to talk to you and give you a little bit of a taste of pathology analysis, I want to be able to give you some special deals on some of our training. So even though I know most of you are probably students, we have had a lot of students do the pathology training, so that they're at a massive advantage when they come out of their courses and their training and qualified, that they're already well informed of pathology results from day one when they start seeing clients. It's up to you when you want to maybe have a look at this in terms of your training. If you're only a fairly new student, it's probably something you want to learn more about, the anatomy, physiology, and biochemistry, etc., before you look at this, but that's completely up to you. I think you'll still learn so much from this training. So we'd like to offer a 25% discount on the courses, and then they're not expensive anyway. So for the Switch on Health students, graduates even as well, a 25% discount on the software if you decide to use that after you've done the training as well. No expiry on this deal. Just quote the SOH, obviously Switch on Health 2023 via email for your discount. At this stage, we don't have a website page specific for Switch on Health. I probably will do that, and I'll send Carmen and or Martin the details of that. But on the pathology analysis website, they'll still have the standard pricing, and yes, you can order the training and online. But if you want the special deal, just send me an email with your interest in the training, and just quote the SOH 2023 deal code there, and I'll manually send through the invoice and payment link, and we'll get you going that way. Okay, if you're interested in a little bit more and following the IIFP, please have a look at our Facebook page and or website there. So the Facebook page is listed. Also, I have a mentoring group as well if you're interested. So it's a big long name, the Oz Naturopaths, Nutritionists and Herbalists Mentoring Group. So there's a post on there. You'll probably learn some interesting things about new research, health and industry topics, new treatments, new products, and even practitioners just asking questions on what would you do for such and such a condition or a case, or asking for advice. We are about to start an online monthly interactive mentoring group starting in September, so it'll probably be next week. So keep an eye out for that. I think it's really informative. It's a lot of fun, and there'll be a lot of sharing of advice and information between practitioners. It's really useful, I think, for students as well. So have a look at that. And if we have any questions, so I'll probably have to throw back to Carmen, and we can probably stop the sharing, perhaps, if we go back to that, or maybe I'll leave it there in case I need to refer anything. But if we got any questions, please.
Wonderful. Thank you, Ross. Before we go to questions, we might just stop the recording just for privacy purposes. If you are watching this live, we'll stop the recording in the moment and we'll open it up for questions. Remember that there will be a draw for a $50 credit. And if you're watching the recording, thank you for watching until the end and learn more with Switch On Health.